Hi, I'm Dr. Vinod Mithil, consultant diabetologist from Vashi, Navi Mumbai, and today I'll be going to answer the question: who is at a greater risk of getting type 2 diabetes? Now, in order to answer the question, we need to know some basics. We all know that insulin is an hormone which is actually responsible for the metabolism of glucose, which is responsible for converting glucose into energy in our body. Now, there are two important things which happens with regards to insulin, which actually leads to development of type 2 diabetes. The first thing which happens is which we call as insulin resistance. Now, what exactly is insulin resistance? Now, insulin resistance is a condition where the insulin is not acting to its optimum, where the insulin is not able to get its desired effects. Now, so what happens when a person gets insulin resistance? The body tries to compensate, and how does it compensate? It's by pushing the pancreas from where the insulin is secreted to form more insulin. Now, initially, this is able to overcome the insulin resistance, but then later on, what happens is the beta cell fatigue. The beta cells from where the insulin gets secreted, they starts getting tired, and then the insulin production starts going down, and it is at this stage where your blood sugar gets rising. So now we come back to our question: who is at a greater risk of getting type 2 diabetes, or what are the risk factors for getting type 2 diabetes? So the first most important risk factor, as we know, is weight. So when you become overweight, when you put on weight, you start getting a condition called as insulin resistance. This happens because the fat cells, which increases with weight, they start secreting certain hormones which actually impedes the action of insulin, and so the insulin resistance sets in, and then the risk of you getting diabetes gets higher. Second thing is inactivity. Again, it's again related to weight. So when you are the less active, more is your risk of getting type 2 diabetes. It's again because of inactivity. Your weight, you start putting on weight. What happens with physical activity is that when you are active, you start burning calories. You start using the glucose for energy, and this helps to keep your blood sugars down. The third important risk factor is family history. So here the genetics is involved. So if you have any first degree relatives with type 2 diabetes, your risk of getting diabetes also increases. So if your one parent is diabetic, risk is there. If your two parents, both of your parents are diabetes, has got type 2 diabetes, your increase is still higher. Then comes race or ethnicity. Now, for reasons unknown, there are certain races which are at an increased risk of type 2 diabetes, and unfortunately, you can see Asians, especially Indians, we belong to a high risk race group for getting type 2 diabetes. Then comes aging. So as you age, what happens is that your level of physical activity goes down, your metabolism goes down. When your physical activity goes down, you start putting up a weight, your muscle loses its tone, and then again you tend to put on weight, and this again increase the risk of you getting type 2 diabetes. Now, next risk factor is in females, that is females who have got an history of gestational diabetes. What is gestational diabetes? Gestational diabetes is the diabetes which you get when you are pregnant. So any lady who has got an history of gestational diabetes, they are at an increased risk of getting type 2 diabetes in future. Then again, a condition, next risk factor, a condition which happens in females, which we call as polycystic ovarian disease. Again, it's something which happens in ladies. This is an insulin resistant condition, which is characterized by increased weight, excessive hair, irregular periods, and obesity. And these ladies are again at an increased risk of getting type 2 diabetes. Hypertensive patients, again a risk factor. So if any of you have got high blood pressure, your risk of getting type 2 diabetes is on the higher side. The next risk factor is abnormal lipid profile. That is when your different lipids are bad. So if your HDL cholesterol, which is the good cholesterol, is low, if your triglycerides is high, then your risk of getting type 2 diabetes is high. So anyone who has got these risk factors, anyone who has got a BMI of 23 or more, irrespective of their age, if they have got any additional risk factor like blood pressure or abnormal triglycerides, these are the people who should be getting tested at least once in a year for diabetes. Anyone who has got an history of GDM, anyone who with a history of PCOD, they should also be getting their blood sugar tested at least once in a year. Above the age of 45, these people are at an increased risk of getting type 2 diabetes, and they should be getting themselves tested at least once in a year. Anyone who has got a family history of diabetes, they should be getting tested after the age of 45 at least for once in a year. And anyone with a history of pre-diabetes is a condition where your blood sugars are not at a diabetic range, but they are not normal, they are somewhere in between. These are also a risk. These are also a group of patients who are at an increased risk of getting type 2 diabetes, and they also should be getting themselves tested at least once in 6 months or once in a year to rule out development of type 2 diabetes. So if any more queries you would like to know, any answers you need to know about the risk, you can always contact me or my clinic, Sweet Clinics at Vashi. Thank you.